I'm Dr. Steve Paul, Senior Consultant Geriatrician at Apollo Hospitals, Banargata, Sheshadripuram, and now at Sarjapur. What we aim to achieve through Seniors First is enhanced care, seamless care across all zones. When you talk about geriatric care, the care is not restricted to hospitals. It starts at often as an outpatient visit, sometimes needing hospital care, post-hospital care, and at home too. So this continuity of care is where we aim to be different compared to other geriatric care services. And this coordination is only possible through a dedicated team and a dedicated health manager who will liaise with the patient and with the doctors such that unnecessary hospital visits and hospitalizations can be avoided. Because one of the strongest predictor for in-hospital complications is delayed care. Patients, especially when it comes to older care, take a lot of time and a lot of thought before visiting the doctor. Unfortunately, by the time they decide to seek the doctor's help, care is often complicated. The need to go to a doctor and to address their health needs is markedly delayed when it is compared to child care. So like how we have specialized child care, pediatrics all across the globe, geriatrics is such a specialty that needs more attention. As I've mentioned, it may be difficult to get geriatricians everywhere, but it is important to talk about geriatrics so that the need rises. When we started off geriatrics in India, it was towards the late 1980s or 90s, whereas in the West, UK, Australia, geriatrics had started much earlier. So we, in that aspect, are a relatively newer generation. But when it comes to geriatric care, we also need to focus on home care. Not all hospitals, not all older persons like to come to hospital. Most of them hate hospitals. But when it comes to hospital care, we can provide hospital care to a reasonable extent at home. This is, I have to emphasize, different from palliative care. Palliative care is comfort care, keeping the patient at home, often at the cost of providing the best care. So when you talk about geriatric care, it's about improving functionality. How independent his or her mother was 1 week back, to get him or her to that extent, to that level of functionality is what geriatrics aims to achieve. And this is not possible by 1, 2, or 3 physicians or geriatricians. It's only possible when we as a team start to think and talk about elder care.
Dr. V. Shankar, Senior Physician, ಶೇಷಾದ್ರಿಪುರಂ ಅಪೋಲೋ ಹಾಸ್ಪಿಟಲ್. ಇವತ್ತಿನ ದಿವಸ ನಾವು ಇರ್ತಕ್ಕಂಥ ಒಂದು ಸೀನಿಯರ್ ಸಿಟಿಜನ್ ಪ್ಯಾಕೇಜ್ ಏನಿದೆ, ಡೆಫಿನೆಟ್ಲಿ ಅದು ಎಲ್ಲ ಜನಸಾಮಾನ್ಯರಿಗೂ ಎಲ್ಲರಿಗೂ ಅದು ಅನುಕೂಲವಾಗಿ ನಾನು ಆಗಬೇಕು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ನಮ್ಮ ಮ್ಯಾನೇಜ್ಮೆಂಟನ್ನು ಅದನ್ನು ಒತ್ತಾಯನೂ ಮಾಡಿಸ್ತಾ ಇದ್ದೀನಿ. ಆದರೂ NGOಸು, ಸ್ಟೇಟ್ ಗೌರ್ಮೆಂಟು, ಸೆಂಟ್ರಲ್ ಗೌರ್ಮೆಂಟು ಎಲ್ಲರೂ ಇದರಲ್ಲೂ ಭಾಗಿಯಾಗಬೇಕು. ಒಬ್ಬರೇ ಆಗೋದಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ನಾನು ಆಲ್ರೆಡಿ ಉಳಿದಿದ್ದೆಲ್ಲ ಇದ್ರ ಬಗ್ಗೆ ಯಾವ ಥರ ಅದರಿಂದ ಪರಿಣಾಮಗಳಾಗುತ್ತೆ, ಅದು ಯಾವ ಥರ ನೋಡ್ಕೋಬೇಕು ಅದೆಲ್ಲ ನಾನು ಮಾತಾಡಿದ್ದೀನಿ. ಇನ್ ಜನರಲ್ ನಾನು ಹೇಳ್ಬೇಕಾಗಿರೋದು ನಿಮ್ಮ ಮುಖಾಂತರ ಏನಂತಂದರೆ, ಇದು ಎಲ್ಲರೂ ಸೇರಿ ಮಾಡ್ತಕ್ಕಂಥ ಏರಿಯಾ ವೈಸು ನಾವು ಐಡೆಂಟಿಫೈ ಮಾಡಿ ಒಬ್ರಿಗೊಬ್ಬರು ಅನುಕೂಲ ಮಾಡಿಕೊಟ್ರೆ ಮಾತ್ರ ಈ ಒಂದು ಕಾನ್ಸೆಪ್ಟ್ ಚೆನ್ನಾಗಿ ಬೆಳೆಯುತ್ತೆ. ಅದು ಎಲ್ಲ ಹಾಸ್ಪಿಟ್ಲಿಗೂ ಇದು ಸ್ಪ್ರೆಡ್ ಆಗಬೇಕಂತೇಳಿ ನಿಮ್ಮ ಮುಖಾಂತರ ಹೇಳ್ತೀನಿ.